Hep 57. Warning signs of liver disease. Seniors should know the liver is one of the most remarkable organs in the human body, performing over 500 distinct functions, including filtering toxins from the blood, producing bile for digestion, synthesizing proteins, storing glycogen for energy, and metabolizing virtually every medication you take. It is also a silent organ. Liver disease can progress for years, even decades, with no symptoms, while quietly destroying liver tissue. By the time symptoms appear, significant and often irreversible damage may have occurred. Liver disease affects an estimated 25% of the global population and is the 11th leading cause of death worldwide. Rates in older adults have risen sharply with the parallel epidemics of obesity, type 2 diabetes, and metabolic syndrome. Today, we're covering the warning signs of liver disease and the lifestyle factors that protect or damage this vital organ. Non-alcoholic fatty liver disease, NAFLD, is now the most common liver condition worldwide, affecting approximately 25% of the global adult population and up to 40% of older adults in Western countries. It occurs when excess fat accumulates in liver cells, not from alcohol, but from metabolic factors, obesity, insulin resistance, type 2 diabetes, and dyslipidemia. In a subset of patients, NAFLD progresses to non-alcoholic steatohepatitis, NASH, which involves liver inflammation and can progress to cirrhosis and liver failure. Alcoholic liver disease ranges from fatty liver through alcoholic hepatitis to cirrhosis, depending on duration and amount of consumption. Drug-induced liver injury is an underappreciated cause of liver damage in older adults who often take multiple medications. Paracetamol, acetaminophen, is the leading cause of acute liver failure when taken in excess. Certain antibiotics, antifungals, antiepileptics, and herbal supplements are also significant causes. Hepatitis B and C. Chronic viral hepatitis, particularly hepatitis C, affects a significant proportion of adults born between 1945 and 1965, many of whom were infected before testing was routine. Because the liver compensates effectively for a long time, early liver disease is often asymptomatic. The following symptoms should prompt medical evaluation. Fatigue and weakness. The most common symptom, often dismissed as aging. The liver plays a central role in energy metabolism, and impaired function produces profound, persistent fatigue. Jaundice. Yellowing of the skin and whites of the eyes occurs when the liver cannot adequately process bilirubin, a bile pigment. This is a significant symptom that always warrants prompt medical attention. Abdominal pain or discomfort in the upper right quadrant where the liver sits. A sensation of fullness or a dull ache. Dark urine and pale stools, both indicating impaired bile flow. Swollen abdomen, ascites, the accumulation of fluid in the abdominal cavity, occurs in advanced liver disease. Swollen legs and ankles, from reduced albumin production impairing fluid regulation. Easy bruising and bleeding, from reduced production of clotting factors. Itchy skin, bile salts depositing in the skin from impaired bile clearance. Mental confusion or fogginess, hepatic encephalopathy, from the liver's failure to clear toxins from the blood. Maintain a healthy weight, the most important modifiable risk factor for NAFLD. Even a 5 to 10% reduction in body weight produces significant regression of fatty liver, including reversal of early fibrosis in some cases. Limit alcohol. The liver's capacity to process alcohol declines with age. Even moderate regular consumption causes progressive liver damage in susceptible individuals. Review medications and supplements. Inform your doctor and pharmacist of all supplements, herbal remedies, and over-the-counter medications. Many are hepatotoxic. Never exceed recommended paracetamol doses. Avoid taking paracetamol with alcohol. Coffee. Regular coffee consumption, 2 to 4 cups daily, is one of the most consistently associated dietary factors with lower rates of cirrhosis, liver cancer, and liver fibrosis. The mechanism involves antioxidant and anti-inflammatory compounds in coffee. Exercise. Regular physical activity reduces liver fat independently of weight loss. Aerobic exercise promotes liver fat oxidation directly. Get tested for hepatitis C. Adults born between 1945 and 1965 should be screened. Effective curative treatments are now available. Liver function tests, a routine blood panel measuring ALT, AST, ALP, GGT, and bilirubin, provide an overview of liver health. Elevated enzymes indicate liver cell damage or stress. Imaging, liver ultrasound is the standard initial imaging for assessing fatty liver and looking for structural abnormalities. Advanced imaging, including FibroScan, measures liver stiffness as a proxy for fibrosis. If you have risk factors for liver disease, obesity, diabetes, significant alcohol consumption, or a family history, ask your doctor about routine liver function testing. The liver has a remarkable capacity for regeneration and recovery, given the right conditions. Fatty liver can completely reverse with weight loss and exercise. Early fibrosis can stabilize or regress. Even significant liver disease, managed well, can be lived with for many years. Know the warning signs. Protect your liver through weight management, sensible alcohol use, and careful medication management. And if you have risk factors, get it checked. See you in the next video.